Hello guys, this is Mujib once again, and today we're going to talk about choking. Yeah, choking is very common. Yeah, like you can be there at your home eating food with your family and someone gets choked. Like can get choked by eating food when you're eating food and the food blocks your airway. So choking, you need to know some first aid. You can find out that you're very far from the health center, you're very far from medical people, but you're with your family, or you are very far in the village away from the hospital. What are you going to do? Are you going to leave someone there? So choking is when there is a foreign body in your airway. So it can be caused by an object or food. So an object or food, they can block your airway. So we have two types of choking. We have mild choking, we have severe choking. So mild choking is when the airway is partly blocked. Yeah, so the person's airway is partly blocked. So how do you see that this person is having mild choking? That person is able to speak, is able to cry, is able to breathe. So this is very common. Yeah, you can see someone who's having mild choking. It's very common. Most cases people get some mild choking and you see someone having those signs, able to speak, able to cry, able to cough and breathe. So here you just instruct the person, just tell them what to do. So if the person is having mild choking, what instructions do you give them? The first one is encourage the person to cough, to try to clear the blockage. So you encourage that person to cough. You tell that person cough until the food gets out of the airway. So the second one, ask them to try to spit out the object if it's in their mouth. So if someone has something about food in their mouth, you tell them, you try and do what? You try and spit out. You tell that person, spit out that food. Yeah. So if coughing doesn't work, then you go for back blows. Yeah, some simple back blows. The person can spit out the object of food. Okay, so let's go to severe choking. So severe choking is the opposite of the mild choking. Yeah? So in this severe choking, like the person won't be able to speak, cry, cough, breathe. So in this severe choking, you can find out that the airway is sometimes completely blocked, whereby the person is not able to cough, to breathe, to cry. Like the person will be just there, like, yeah, that is severe choking. So here you're supposed to come by yourself. You won't instruct that person who's not able to do those things, yeah, because that person can even collapse. Here you come, you give first aid by yourself. First of all, what do? You stand behind the person, like, and slightly to one side. Yeah, like you stand behind that person slightly to one side, and then support their chest with one hand. So lean that person forward so that the object blocking the airway will come out of the mouth rather than moving further. So the second step is give up to 5 sharp blows between the person's shoulder with the heel of your hand. Yeah? With the heel of your hand. So the heel of your hand is that area, like between the palm and your wrist. So that area within the palm and your wrist. Yeah. Check if the blockage has cleared. So if the blockage has not yet cleared, you should give the person like abdominal thrusts. But those abdominal thrusts don't go with pregnant women, with babies. Yeah. So those abdominal thrusts, like, they don't apply. You should not give them to babies and pregnant women, and also obese people. Yeah. So how do you do the abdominal thrusts? So So when you're doing abdominal thrusts, yeah, stand behind the person who is being choked. Place your arm around the waist and bend the person forward, yeah. So I'm going to put some pictures here down so that you can see them. Clench one fist and place it just above the person's belly, yeah? Then place your other hand on top of your fist and pull sharply inwards and upwards. So you can repeat it 5 times. So that's how you can help someone who has been choked. Yeah, that's the first aid of choking. You should try it out. Yeah. So most cases people are affected by that mild choking, yeah. So you should be able to give out. So you should not do those other things which you've been doing, giving a person water when you are seeing that person is being choked, yeah. Giving some person water, you don't know what to do. So thank you very much. I remain Mujib. Yeah, I remain Mujib. So please try to follow me up. Yeah.